So if you ever find yourself in a situation where you've had some kind of a wreck or a mishap of any type and you wind up with a cast, I've been asked, what do you do? Well, the first thing you're going to want to do is always work both open ends of your cast. So with the PBM light, I've got it on the first setting, which is just our red setting, because I'm not really looking to do anything but encourage circulation. And I will work my fingers and my thumb to the point where I have movement like this. And a lot of people do not have that kind of movement while they're still under cast. Always make sure you do the top and the bottom for a couple of minutes each. And this particular cast is only hard on the bottom side, and my stitches are underneath here. So I can't get to those with my light, and that's okay. I can get to all of this, which is still just padding. And now I'm going to turn it up to the second setting because I do have the infrared, and that's going to help put all of that through. As you can see, it's getting through. And I'm going to be able to work the top part of this fracture. And I do this a couple times a day. Anytime I feel pain up in here, which is, your wrist is only this fat, and so I've got a big plate down here with 6 screws. All of this area is affected. But I've had surgery a week ago. And at this point, I'm very pleased with the movement of all my fingers. I can touch, 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 and touch, which is very amazing. So just know that just because you have a cast, it doesn't mean you cannot use your lights.
The power of healing is right in your hand when you hold the amazing light.